Before I begin the presentation, I just wanted to give you an update of who I am. So, as the title slide says, my name's Cameron Weighill. I was certified in 2001. I became a CIPHI Ontario member in 2004, and became a member of the CIPHI Ontario executive in 2007. I was then entered in 2010 entered the CIPHI branch president stream, and was CIPHI Ontario president from 2013 and 2014, and I'm currently the past president. From 2010 to 2014, I was also participated with CIPHI on the at the national level through the National Executive Council. So one of the goals of the CIPHI Ontario branch executive, which was set through one of our strategic planning session, was that all individuals using the CPHIC credential in Ontario must participate in a discipline-specific continuing competency program. And we want this just to ensure everyone using the credential maintains their skill sets, thus ensuring the integrity of the credential. So to accomplish this, we've been utilizing two strategies, which I'll discuss in detail today. One is to advocate and support the National Executive Council strategic objective to move towards mandatory membership. And secondly, to advocate for changes to Ontario Regulation 566, which sets out the qualifications of Board of Health staff. And I'll go into that a little bit more in a bit. But first, I'm going to start with some of the background at the regards to CIPHI. So in 2005, actually in Toronto at the National AGM, a resolution was passed that directed the NEC to move towards mandatory membership. I think CIPHI was may have been a little naive at the beginning part, thinking this was going to be an easy task to accomplish. And as part of an informal legal review, soon after that resolution, it was determined that CIPHI was missing some major components that were needed before we could potentially move towards a mandatory membership model. Through fundings through the Canadian Public Health Agency of Canada, in 2010, CIPHI launched their continuing professional competency program, which is administered by the Council of Professional Experience. This program includes discipline-specific competencies, a code of ethics, a professional development monitoring model, and this program participation in this program is mandatory for CIPHI members. And once again, while it's mandatory for CIPHI members, the current model does not require individuals to maintain membership and participate in the program after they're certified. In 2012, the NEC commissioned a report which was produced by Andy Hong, looking at mandatory membership and a plan to achieve that. So doing an environmental scan, looking at other professions, and looking at the components that we needed to address before we could move down that road. During that same year, as part of a national membership survey, we found that nearly 70% of members supported mandatory membership for newly certified individuals after a certain date. And then based on this information and the information from the report by Andy, in 2013, during a CIPHI strategic planning session in Winnipeg as part of our centennial celebrations, it set mandatory membership as a priority. And this was a very unique strategic planning session. In the past, the National Executive Council would have its own strategic planning session, and so would the Board of Certification, and so would COPE. During this session, actually all branches of CIPHI came together and set mandatory membership as a priority for each of the arms of CIPHI. Then in 2014, there was a follow-up strategic planning session here in Toronto, where the same group, the various arms of CIPHI got together again and started to mapping out our pathway towards mandatory membership, which leads to this year in the notice of motion that myself and Raymond Ramdell put forward, looking at mandatory membership for individuals certified after January 1st, 2017. Just to quickly go, most of you probably have seen the motion already. I'm not going to go over the full thing, but just some go over some points in it. One item that you probably may not have been aware of, because it's kind of fresh off the presses, is that the BOC have amended their regulations. So beginning on January 1st, 2016. To sit the board exams, students must be CIPHI members. So the meat of the current resolution is that the NEC take all necessary actions required to incorporate the annual maintenance of a regular membership and the subsequent participation in the CPC program as a requirement for the maintenance and use of the CPHIC credential for all individuals certified after January 1st, 2017. And that the NEC develop and implement a communication strategy to inform stakeholders of this change. So I think one of the quick question is, why only mandatory membership for newly certified individuals? And because most of us want to see everyone and have to be members. Well, there's a number of reasons why CIPHI is taking the strategy. One is for those who had received their credential before July 1979, it was actually issued by the Canadian Public Health Association and actually not CIPHI. So I know this represents a very small portion of the current regular membership, though it's one area that since CIPHI did not issue the credential, we couldn't necessarily require it at this time. Before we can do that retroactive mandatory membership, a legal opinion is needed before implementing as mandatory membership was not a condition when the individuals on the line actually receive their credential. So there are some legal implications on now going back and requiring it. There has been some discussion at the NEC level that we could potentially go back to a requirement back to 2005, as that was when the original motion was set to move towards mandatory membership. But there's some additional legal work that needs to be done before we can that could be considered. It also, by doing this graduated approach, it ensures we have sufficient capacity to manage and enforce this new requirement. Except for a few contract staff at the national office, all CIPHI executive members are all volunteers, whether it be on the NEC, BOC, or COPE, and just CIPHI currently doesn't have the capacity to manage and enforce this new requirement for mandatory membership on 1,500 individuals starting on a specific date. So it just allows us to gradually build up capacity. But what it does do is it creates a new professional standard of mandatory membership. In discussions with some employers, when they've had discussions with their HR department, one of the reasons why they haven't been able to potentially incorporate membership into their job description in the past is when the HR asks them, well, is membership mandatory? And they have to respond back that currently the current model is that membership is voluntary. But by switching to a mandatory membership for newly certified individuals, it changes the standard. So it now mandatory membership becomes the standard versus voluntary. And finally, this is just the first step. It does not preclude the NEC from implementing mandatory membership for all credential holders in the future. This is just a first step down our path. So moving on to our second strategy, which is to advocate for changes to Ontario Regulation 566. As many are aware, Regulation 566 basically it sets out the requirements for employment as public health inspectors and sets out the requirements for the enforcement of the HPPA. So we're specifically looking at two sections, Section A and Section C. Section A is the certificate granted by the BOC, and Section C is the certificate being that had been issued by the Canadian Public Health Association prior to January 1st, 1979. And I guess the question is why this legislation and not the Health Professionals Act? And to give some background on that, I just wanted to go some of the previous attempts that we've done towards trying to move towards mandatory membership. So in the 1950s, Thomas Elliott, a past national and Ontario branch president, advocated for licensing and registration requirements for continuing education with the Ontario Ministry of Education, and unfortunately was unsuccessful. In between 75 and 77, Phil Barton and the executive proposed a Public Health Inspector Act, but legal counsel could not be convinced, couldn't convince the Ontario Ministry of Health, the Ontario Ministry of Environment, or the Ontario government in general that this was necessary at the time. In 84, the Ontario when Ontario updated the Ontario Health Professionals Act, again the Ontario branch presented a case for licensing and regulation. However, the Ontario government decided not to include PHIs as a regulated health profession at that time. In the 90s, we again attempted to be included as part of the Regulated Health Professionals Act. The individuals at the time presented the rationale that improper public health inspector assessments and decisions during an investigation could negatively impact a client. But once again, our application to be included was rejected on the basis that PHIs do not have hands-on activities with clients, therefore could not be included. So we've tried the Regulated Health Professionals Act numerous times, and we're unsuccessful. And it's with informal discussions with the ministry, it was very clear that if we tried to go down this route, that we would be unsuccessful again. So we decided that we needed to really look at another option, and that's where we started looking at targeted regulation, Ontario Regulation 566. So this began our advocacy project around Regulation 566 in June of 2013 with the creation of the Regulated Profession Working Group. The chair of this group is Beth Driscoll, and she's been doing amazing work. We have Klaus Siegel, who is a current life member for CIPHI. Myself, Ken Gorman, who is also the Ontario branch representative on the Council of Professional Experience, as well as Christina Milano, who's been providing a great front-line perspective to our discussions. So the first order of business was the develop a position paper for the Ontario Branch Executive Council. This position paper outlined the following rationale: that public health inspection is a profession, that public health inspection is a health profession as defined by the Ontario legislation, and that professionals have the right to self-regulation. And that a component of self-regulation is the requirement that members formally maintain their competencies, and that finally that the Ontario Public Health Standards requires boards of health to ensure a competent and diverse public health workforce by providing ongoing staff development and skill building related to public health competencies. So that paper was developed and adopted by OBEC in 2014 and distributed within the province with our prime target being CIPHI Ontario branch members. This year, we started to move on to the next phase of our project, and which was the development and publishing of the a position paper in the Environmental Health Review. This is basic, for the most part, the same as the paper we distributed to members the previous year, but with some slight alterations to make it to target a more broader audience. So this targeted health professionals across Canada. And then this April, we started to move on to developing the proposed changes to our regulations. So once again, there's two, looking at the Regulation 5.6, and what we're going to be advocating for is the addition to an addition to each of sections A and C, with the addition of and participate in a discipline-specific continuing competency program on an annual basis. And this is for both of the sections associated with the credential. Once we've had our proposed wording completed, we developed and distributed question and answers fact sheets to stakeholders, and those were actually distributed out through the CIPHI Ontario listserv as well. And then we began to look for letters of support, and we've received a lot of support from this initiative. We currently have letters of support from CIPHI National, as well as ASFIL, Alpha, the Canadian Public Health Association, and this was an important one to get because, as you saw, Section C is actually refers to the credentials they actually issued. So their letter of support basically outlines that in addition to this Section A, that they would like to see Section C changed as well. And we're just in the process of waiting for a letter from the Public Health, the Ontario Public Health Association. And I just wanted to go back to this to Regulation 566, and because through my discussions with members, there was discussions on why don't we just say that require membership versus rather than participation in a CPC program. And this discussion was strategic. It's the Ontario branch felt that it's very difficult for employers to argue that their staff should participate in a discipline-specific competency program. There were some discussions that requiring membership was a little bit of a more difficult sell. But you have to remember that this change to Regulation 566 isn't actually occurring in a vacuum, and that we have to look at what's happening at CIPHI National. So if this Regulation 5 changes to the 566 came in, does it mean that employers could create their own system? And yes, it could. And through our advocacy process with the ministry, we'd likely want to set up minimum standards for what a CPC program would be. But once again, this is likely going to be a majority of employers will, I foresee, including a requirement to be a member as part of the job, because not only does it allow someone else to do the administration of the CPC program, it allows for a third-party auditing of their staff to show their competency. So it's not necessarily the employer certifying that their staff is competent, it's their professional organization. But like I said, we can't look at this initiative in a vacuum. We have to look at, if you look at what's happening at the national level and with the potential move towards mandatory membership for newly certified individuals, in a couple of years, for those employers that potentially are running their own system, they're going to have staff that will be required to participate in the CIPHI program as membership is now mandatory and participation in the CIPHI program is mandatory, as well as potentially any program that the employer has developed. And especially when you enter into unionized environments, unions don't necessarily like to see their staff being or their members being evaluated using two different measures. And under those circumstances, since the CIPHI CPC program will be a mandatory requirement for a portion of their staff, that at that point I see any employers that are potentially using their own system flipping over to the CIPHI system at that time, just for administrative reasons. Which moves us on to next steps. It's important not only to this motion pass, that this motion, that we have strong support for this motion. So if you haven't done so already, I strongly encourage you to complete your proxy vote, and it would have been one of the reasons, a link to that, to the proxy vote would have been in the confirmation email that you got for this webinar. So either complete it and send it off to the office, or give it to one of your colleagues that will be attending the AGM in Ottawa at the conference. In regards to next steps for CIPHI, first is just ensuring that this mandatory membership motion passes. Once it passes, it does mean there's going to be a lot of work for CIPHI over the next years, getting us ready for this paradigm shift in our profession, and there likely will be opportunities for members to volunteer to help COPE, BOT, or the branch move towards this new model. In regards to the regulated profession working group, we're going to continue to request support from public health stakeholders across Ontario. And this fall, we're going to be starting to develop and implement a strategy for our advocacy strategy directed to the Ministry of Health and Long-Term Care. We're aware that this isn't a slow. Is not a, when you're dealing with government, it's never a fast process. So we're not necessarily expecting, even if our advocacy is successful, for any changes for at least 1 to 2 years. So it's still a ways out. If you have any feedback, questions, or suggestions regarding the process, not whether it be the Regulated Profession Working Group or what's happening around mandatory membership at the national level, please contact Tony or myself. If you have questions specifically regarding the Regulated Profession Working Group, you can contact Beth Driscoll. I know I covered a fair bit in a short period of time. So if anyone has any questions, I will unmute the mic so you can either ask the question over your microphone on your phone, on your computer, or you can enter the information in the chat.